I hate cortisone. Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. Watch this video to see why I hate cortisone.
Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
Cortisone is an anti-inflammatory. Cortisone is actually made in our bodies. It's made on our adrenal glands, which are back, on our kidneys, on the top part of our kidneys. So it is a, quote, natural substance, but it's not made naturally. They make it in a lab or in a factory, and so it's really technically unnatural. But it is a very potent anti-inflammatory. So cortisone can definitely decrease the itis or the inflammation, and it's very effective at doing that. I mean, another positive is it usually kicks in pretty quickly. You can take it by mouth. The problem with that is then it goes through your whole body and it can negatively affect your body in many ways, including your adrenal glands. It can shut down your adrenal glands, which you don't want, by taking stuff from outside your adrenal glands, say, hey, I don't have to make any more, and they start to shut down. So that's always a bad thing. It can make your blood sugar go up. Diabetics, that wouldn't be good for. It can decrease wound healing. That's not good if you're having surgery or you have a cut or an infection somewhere. It can make that infection worse. Orthopedically, it can cause a thing called avascular necrosis. Avascular means no blood supply. Necrosis means death. So it can decrease the blood supply, particularly in the hip. For some reason, the hip's more prone to this. It can decrease or cut off the blood supply in the hip and kill the bone in the hip. And first of all, it's very painful. Secondly, it almost always leads to a hip replacement. It's going to affect the rest of your body before it really helps your knees. It can help, but it's definitely temporary, not going to last more than the time that you're really on it. Now, what we do in orthopedics is we'll give shots. So that does require needles. That's kind of a downside. We have to stick a needle into the joint or the bursa or the tendon or wherever, and that decreases the inflammation. So that's the good part. The bad part is it weakens tendons, it weakens ligaments. So if you inject near the Achilles tendon, which is the big rope-like tendon behind your ankle, that is very prone to rupturing if you put a cortisone shot next to it. Who would ever want to do that? So I never put a cortisone shot next to a tendon. Maybe the rotator cuff very rarely, but even nowadays with PRP, platelet-rich plasma, bone marrow aspirate cells, laser, which is totally non-invasive, we can decrease inflammation without having to worry about the risk of a tendon tearing or your blood sugar going up or a wound not healing. We know for knee arthritis, which I know is the specific example, it can decrease inflammation and swelling in the knee. It can kick in pretty quickly. It only lasts about 3 to 6 weeks on average. Its effectiveness, it may decrease inflammation, so you might feel better for longer than that. But the actual effectiveness, how long it lasts for in the body, is on average about 6 weeks. And it's not treating the root cause. And then the kicker of all time, cortisone actually increases the rate of arthritis. It causes the cartilage on the end of the bone to wear down faster, and there are studies that prove this. So why would we ever give somebody something in their knee that's going to make the arthritis worse in the long run? And that's what cortisone does. I almost never use cortisone for knee arthritis because of the fact that why would I give somebody something that's known and proven to make them worse?